Okay, Bobbie, so it looks like you were admitted for a coronary bypass surgery and you've been here for 5 days and today's your day to go home. That sound good?
Yep.
All right, before we go, we're going to go over a few things. The first thing I want to go over with you is I want to go over some signs and symptoms of some complications of your surgery, okay? If you experience any of these, I want you to call us right away.
Okay.
So our first one we have is bleeding from the surgical site, any infection and some signs and symptoms of infection. We have like fever, chills, malaise, like some kind of like flu-like symptoms, almost like feeling down. Any pneumonia, so that by that you'd experience shortness of breath, difficulty breathing, productive coughs when you cough, when you come up, and you'd have some chest pain with that. We can also have an abnormal heart rhythm, which is also called a dysrhythmia, and with that you would experience chest pain, palpitation, which is kind of like you can feel your heart beating in your chest, or like a flutter. You can have a slow or racing heart rate, shortness of breath, and you can faint. And the final one we have is a failure of the graft. So what that would be is you would have severe chest pain, unrelieved by any medication for your angina, so like for your chest pain, or unrelieved by a change in position and severe shortness of breath. Does that sound okay?
Mm-hmm.
All right. The next thing I have is I just want to go over a few things for our priority concerns and diagnosis. So it looks like you have a history of congestive heart failure, high cholesterol, type 2 diabetes, and smoking. And those are the ones I want to focus on right now. So with a history of those, sometimes the coronary arteries can become blocked or lined with plaque.
What is plaque?
Plaque is a semi-hardened accumulation of fat, cholesterol, calcium, and other substances found in the blood. And what happens is over time that plaque can build up in your arteries and can kind of line them and narrow them, which kind of restricts blood flow. So when that becomes blocked, it limits blood flow, resulting in the body not getting enough oxygen-rich blood. So your bypass surgery they did essentially bypassed the blocked area of the artery, which restored normal blood flow. Smoking also damages the airways and alveoli of the lungs and also contributes to a stiffening of the arteries. So with that, smoking cessation, so if we stop smoking, it can reverse the arterial stiffening and hypertension. The doctor also started you on 2 liters of oxygen to keep your O2 saturation above 93%.
What is oxygen saturation?
Oxygen saturation is the fraction of oxygen-saturated hemoglobin, which is the protein that transports oxygen in the blood. Your normal O2 saturation should be anywhere between 95 and 100%, so we want to keep you up there, okay? I think what you should do is you should think of the portable oxygen. So as they're taking you home on the portable oxygen, the 2 liters, you should think of that almost as another medication. So we want to leave the liter flow at 2 liters unless otherwise directed. And if you feel shortness of breath at all, that maybe we would need to bump it up, give us a call and we can come in and do that for you, okay? We should also always have a 3-day supply on hand of oxygen, so do not smoke when the O2 is in use. Do not use electrical equipment or flammable materials near the O2 tank. We also want to prevent tanks from falling, so we want to keep them in an upright and a stable base and out of direct sunlight, okay? Finally, we want to go over that type 2 diabetes management. So the doctor recommended a diabetic diet, which includes moderate amounts of fruits, vegetables, and whole grains. We want to eat at regular meal times with foods that are naturally rich in nutrients and low in fats and calories. We want to maintain an adequate weight, anywhere between 145 to 190 pounds. We want to exercise at least 30 minutes daily. So walking is a great one to start with, which may also help with the edema in your feet.
What is edema?
Edema is the accumulation of fluid in the tissues resulting from a disrupted balance of fluid in the vascular system, which causes swelling. So your cells essentially aren't moderating the fluid and it just causes a backup. Finally, one of our last things, I want to go over some of your medication side effects. And I know some of these words are going to be kind of big and scary, but I'm going to go over them. If you have any questions, you can stop me, okay?
Okay.
So the first med we're sending you home on is metoprolol, 50 milligrams by mouth twice a day, which reduces your MI risk and treats your hypertension. Some of our side effects for that one are bradycardia, cardiac arrest, AV block, pulmonary and or peripheral edema, chest pain, agranulocytosis, thrombocytopenia, purpura, and bronchospasm. And I know some of those words in there. So agranulocytosis is a low white blood cell count, so that's what moderates your infection. Thrombocytopenia is a low platelet count, so that's what clots. And then the next med I have for you is furosemide, 20 milligrams by mouth, which you're going to take twice a day, which treats edema and congestive heart failure. So with that one, some of the side effects are circulatory collapse, renal failure, thrombocytopenia, agranulocytosis, leukopenia, neutropenia, anemia, Stevens-Johnson syndrome, and topic epidermal necrolysis. And Stevens-Johnson syndrome is a painful rash with blisters that's accompanied by flu-like symptoms. And again, I know some of these are pretty scary, but they're also very unlikely. And if you would experience any of them, we can always have you come in and we can switch to medication. They're also sending you home on potassium 20 milliequivalents by mouth once a day to treat your hypokalemia. So with that, some of the side effects are cardiac depression, dysrhythmias, cardiac arrest, peak T waves, shortened R wave, prolonged PR interval, and a widened QRS complex.
What is a QRS complex?
A QRS complex essentially represents the electrical impulses in the ventricles and atria, which are the chambers of your heart, okay? The next med I have is warfarin 5 milligrams by mouth 1 time a day, which is for MI prevention, and it's an anticoagulant. The side effects of that med are hepatitis, hematuria, hemorrhage, agranulocytosis, leukopenia, eosinophilia, anaphylaxis, exfoliative dermatitis, and purple toe syndrome. And purple toe syndrome is essentially large purple sores that will accumulate on your feet, and they'll be painful. The next med I have is gabapentin, which you're going to take 300 milligrams by mouth 3 times a day for neuropathic pain. The side effects are seizures, suicidal ideation, leukopenia, Stevens-Johnson syndrome, and thrombocytopenia. The next med, we only have 4 more, I promise, is aspirin, 81 milligrams by mouth, which you're going to take once a day for your MI and angina prevention, so chest pain, and it's also an antiplatelet. So with that, some side effects that can occur are seizures, coma, intracranial hemorrhage, dysrhythmia, GI bleeding, hepatitis, hemolytic anemia, bronchospasm, anaphylaxis, laryngeal edema, and angioedema. Docusate sodium, you're going to take 100 milligrams by mouth, which treats your stool softener. So I noticed that you haven't had a bowel movement in almost a day, and the last bowel movement you had was kind of small, so it's just going to kind of make it a little easier. And sometimes that can happen. I know you've been here for 5 days, and so with the immobility of not moving around, that can also contribute to that. So some side effects of Docusate are throat irritation. It can have a bitter taste when you take it. It can cause nausea, abdominal cramping, and diarrhea. Januvia or Siglapitin, you take 100 milligrams by mouth once a day, and it's that anti-diabetic, so to treat your type 2 diabetes. Some side effects of that med are pancreatitis, acute renal failure, anaphylaxis, Stevens-Johnson syndrome, and angioedema. Our final med we have is hydrocodone, which is also cut with acetaminophen, and so that's a 5 to 325 milligram ratio. We're going to take 1 to 2 tablets every 4 hours as needed for pain. So when it comes to the 1 to 2 tablets, I know sometimes that can be confusing. So if you're in severe pain, we definitely want to take 2. But even if we're getting into the moderate, we still want to take 2 because we want to treat it before we get to severe, okay? So some side effects for that med are circulatory depression, respiratory depression, pulmonary edema, and bronchopneumonia. Do you have any questions on your medications?
I don't.
Okay. Finally, I just have some general information before we let you go, okay?
Okay.
I understand that you're heading home with your wife and that both of you are retired and you would like to return to full independence, right?
Mm-hmm.
There are just a few things we want to go over, and we want to adhere to these limitations now so that we can get back to independence. So after your surgery, we don't want to lift more than 10 pounds, so think of a gallon of milk. We don't lift more than 10 pounds for the next 4 to 6 weeks. The incision that we have on your leg, it can be cleaned with soap and water 1 time a day and allow it to dry to open air, okay? And finally, in 2 weeks, you'll have a follow-up appointment with your primary care physician to see how you're doing. Do you have any questions for me before I let you go?
I don't.
Okay, well, I hope you have a great day.
Thank you.